No more GERD. Gastroesophageal reflux disease (GERD) refers to the reflux of excessive stomach and duodenal contents into the esophagus, causing symptoms such as heartburn, and can lead to esophagitis and damage to tissues other than the esophagus such as the pharynx, larynx, and airway. Gastroesophageal reflux disease is very common in Western countries. About 7%–15% of the population has gastroesophageal reflux symptoms. The incidence increases with age. The peak age of onset is 40 to 60 years old. There is no difference in the incidence between men and women, but there are some side effects. Flow esophagitis affects more men than women, 1 to 3, 1. Common signs and symptoms of GERD include burning sensation in the chest, heartburn, which usually occurs after eating and may be worse at night or when lying down, reflux of food or acid reflux, pain in the upper abdomen or chest, difficulty swallowing, a feeling of a lump in your throat if you have nocturnal acid reflux. You may also have persistent cough, inflammation of your vocal cords, laryngitis, new or worsening asthma. If you experience chest pain, especially if you also experience shortness of breath, jaw or arm pain, seek immediate medical attention. These may be signs and symptoms of a heart attack. GERD is caused by frequent reflux of acidic or non-acidic stomach contents. About half of the patients with gastroesophageal reflux disease show esophageal mucosal erosion, ulcers and other inflammatory lesions under endoscopy, which is called reflux esophagitis. However, a considerable number of patients with gastroesophageal reflux disease do not show signs of reflux esophagitis under endoscopy. Gastroesophageal reflux disease is called endoscopically negative gastroesophageal reflux disease. The clinical manifestations of gastroesophageal reflux disease are diverse and vary in severity. Some symptoms are more typical, such as heartburn and acid reflux, while others are difficult to recognize, thus the diagnosis and treatment of this disease have been ignored. Many patients have a chronic relapsing course. 1. Heartburn and acid reflux are the most common symptoms of gastroesophageal reflux disease. Heartburn is a burning sensation behind the sternum or under the xiphoid process, often extending upward from the lower sternum. It often appears 1 hour after a meal and can be aggravated when lying down, bending over, or when abdominal pressure increases. The influx of stomach contents into the mouth without nausea or exertion is collectively referred to as regurgitation. The reflux material in this disease is mostly acidic, which is called acid reflux. Acid reflux is often accompanied by heartburn. 2. Dysphagia and odynophagia. Some patients have difficulty swallowing, which may be due to esophageal spasm or dysfunction. Symptoms are intermittent and can occur with solid or liquid foods. Dysphagia in a small number of patients is caused by esophageal stenosis, and at this time the dysphagia may continue to worsen. Severe esophagitis or complicated esophageal ulcer may be accompanied by pain in swallowing. 3. Retrosternal pain. Pain occurs behind the sternum or under the xiphoid process. In severe cases, it can be severe stabbing pain, which can radiate to the back, chest, shoulders, neck, and ears. At this time, it resembles angina pectoris. Most patients develop heartburn, but some patients may not have the typical symptoms of heartburn and acid reflux related to gastroesophageal reflux disease, making diagnosis difficult. 4. Globus hysteria. Some patients complain of pharyngeal discomfort, foreign body sensation, cotton ball sensation or obstruction feeling, but no real difficulty in swallowing. This is called globus hysteria, which may be related to the increase in upper esophageal sphincter pressure caused by acid reflux. Reflux material irritating the throat can cause pharyngitis and hoarseness. Inhalation of reflux material into the organs and lungs can cause recurrent pneumonia and even interstitial pulmonary fibrosis. Some non-seasonal asthma may also be related to reflux. In the above situation, if the accompanying reflux symptoms are not obvious or ignored, it will not be cured due to improper treatment. Factors that increase your risk of developing GERD include obesity, bulging of the top of the stomach above the diaphragm, hiatal hernia, pregnancy, connective tissue disease, such as scleroderma, delayed gastric emptying. Factors that worsen acid reflux include smoking, binge eating or late-night eating, eating certain foods triggers, such as fatty or fried foods, drinking certain beverages, such as wine or coffee, taking certain medications, such as aspirin, concurrent medical conditions disease.